name is Matthew Byrne. I work for Ortho Arkansas in Little Rock, Arkansas, and I'm a hand, wrist, and elbow surgeon.
What's your favorite case these days?
Spent some time kind of thinking about that. I still like fractures, so that's kind of what I like putting together, especially big complex trauma. And granted, I'm in private practice now, so I don't see as much complex trauma, but we covered two level three hospitals. I had a lady who was in a kind of terrible car accident. So she had kind of a transcaphoid perilunate with a crushed distal radius fracture. And she actually had bilateral distal radius fractures. One side I was able to treat non-operatively. Um, and putting the parts of that back together, it was a long case, but it was a lot of fun. And I like piecing puzzles together, and it's always great when it ends up looking well, does well in the end. The other interesting thing with her, it was an open distal radius perilunate. So a partner of mine reduced it, X-fixed it, and then I came in the next day to fix it definitively. And following her post-op, she actually developed clawing. She had ulnar neuropathy. So I took her back and opened up the ulnar side again where we irrigated initially. And she had this one scar band that was bending her ulnar nerve about 60 degrees around it. And I released that, and she felt almost immediate relief in the numbness and tingling. The clawing still resolving, but her first dorsal neurosis is back to 4 out of 5 strength. So I'm hoping with time, because we got to it fast enough, that she'll be able to get that back. But it was fun.
Sounds like a great complex case.
Oh yeah, yep. I was thinking about another one I did recently. This is not recent, but within the last year, about 5 months ago, I had a patient come in doing their research on hypothenar hammer and asked about an arterial vascular graft rather than a venous one, which is what I've mostly done in the past. So I did some research, as I find myself doing a lot in hand surgery, and I did a descending branch of the lateral femoral circumflex artery graft for reconstruction of his hypothenar hammer. And he's done great. I've been Dopplering him every visit he comes in. It's still patent. He's got good flow to his fingers, and he's very happy. One of my happier patients.